choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hi, it's Dr. Lederman with the Radiosurgery Hour, talking about health and cancer and trying to get better care and better health for you all. The next patient I want to talk about is a man who came to us with a PSA 9.1 Gleason 7. So he's a man about 350 pounds, pretty good size, and he's had bilateral hip replacements. So obviously surgery would be pretty morbid for him. For Gleason 7, surgery has a 60% success rate compared to 90% with radiosurgery and brachytherapy, which is our method of treatment. So we showed him our data. He was actually going to go someplace else. His urologist sent him to us. His urologist is a man that's seen our work over many, many years. He has hip replacements, which means that it's harder to visualize the prostate. So this man, we actually did an MRI of his prostate. MRI doesn't have the distortion that CAT scans have with hip replacements. So we're able to see exactly where the prostate is and do the planning with MRIs. So he wants non-invasive treatment, and again with us, most likely he will keep his sex life and urinary life and avoid complications. Our treatment takes about half the time of just external radiation or IMRT. A lot of men get 8 or 9 weeks of intensely modulated radiation therapy for Gleason 7 cancer. But that's not actually the best treatment. That has about a 60% success rate compared to 90% with a shorter course, but more intensive course using brachytherapy, where we actually put radiation seeds directly into the prostate. So we hope to have a great result for him. How do you measure results? Well, if you look at our prostate booklet, you will see the likelihood of being cancer-free. So we know from thousands of people before you. And then we'll follow your PSA. So for this man, his PSA should go down to the 0 range. Right now it is 9.1. So usually it goes down by about 50% every 6 months. So what he wants to see is that is going into remission, that his PSA is going down, and that he's successfully treated. So we'll report back to you on him. And again, if you want our prostate cancer booklet, you can call us directly, and we will provide that booklet to you. So, good luck to you. We will work hard to get you cancer-free. And another part of the body, so we're kind of bouncing from top to bottom. This woman came to us with a 2.5 centimeter pituitary tumor. She was seen by neurosurgeons who wanted to remove her pituitary, where the pituitary is located in the head. It's kind of the master gland that controls our thyroid and our sexual function, and without it, we lose a lot of function and need a lot of replacement, and obviously It's better to have what God gave us than try to replace it. So the beautiful thing about radiosurgery is that we can treat this pituitary tumor non-invasively. We were actually the first in New York to treat brain tumors. And by treating brain tumors non-invasively, there's no cutting, no bleeding, no hospital stays, no operating room. And in our facility, you just walk in. We're an outpatient treatment center, so it means that you don't sleep in our place. It means you come in, get a treatment. A treatment lasts about 15 minutes. We can aim at the pituitary. We treat a lot of benign tumors of the head, like acoustic neuromas and meningiomas. Success rate is very high for pituitary tumors. We just treated a man last winter. His tumor was 1.5 centimeters, and at the immediate end of the treatment was already 1.4 centimeters, and now it's 1.3 centimeters, just within months of ending treatment, how quickly it shrinks. So we hope the same for her. She's chosen to go with us, and she will start her treatments this week, and we will report to you on how she's doing as she does it. And there's another woman who has metastatic cancer. One of my colleagues came and he said, we have a lot of patients with stage 4 cancer. Stage 4 means it's spread. It's got in the bloodstream and spread. It can spread wherever the blood goes, which is most anywhere, the brain, the lung, the liver, the kidneys, the bone, lymph nodes. So this woman has had cancer for 10 years. She did, at the beginning, have surgery and chemo, and it didn't work, and she almost died from the chemo. And she's decided just to go with radiosurgery, and we've treated a variety of spots, recently in the lung, recently in the liver, and she's in remission. And there's quite a few patients, actually. We had another man walk in last week with gastric cancer, metastatic to the liver, stage 4. We treated him a year and a half ago, and he's in complete remission from stage 4 cancer. Wow. And here's a lesson case. We had a man that came to me in March he was treated elsewhere for pancreas cancer spread to the liver. No, we treated his pancreas, we treated his liver, and then he decided to go get chemo elsewhere. And the chemo doctor told me, the treatment didn't work, he's got more cancer in the liver. So I said, well, okay, let me see the proof. We like the proof. And they got the proof, and actually what the radiologist did was to compare scans from December until now. Well, he didn't come to us until March, and we got all the scans reviewed March to now. He's in remission. So it's very important to have the right scans, to know when you're looking at the cancer, and to know if you're in remission or not. So that's why it's so important to know the scans, know the radiologist, know where you're going, and hopefully you'll be in remission too if you need to be, like this man with stage 4 pancreas cancer and liver mets. This is Dr. Lederman. I just want to thank Bruce for a great show. You can call us anytime you want at 212 Choices. If you want that booklet DVD, please call us during the work week, Monday through Friday, 212-246-4237. Thank you very much for listening. I appreciate your support. God bless you, and have a great week. See you tomorrow on WOR. We have 4 shows. Thank you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation, and it just didn't work or didn't get the desired effects. All of a sudden, you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist, first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES. 12-CHOICES. 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 12-CHOICES.